Very good evening, friends. Meeting in the session of Materia Medica, and we have started discussing about one of the important remedy from our homeopathy, that is Stramonium. Some part of it we have discussed in last lecture with few cases. Today we're going to learn remaining part of the Stramonium from the Allen Skinner's. Earlier, we have discussed how the Stramonium patient is there specifically at the mental psychological level. That's what we have discussed. Today, before going into the remaining part from the Allens, I will share one case which I have treated a way back. In fact, I was not confident that homeopathy can do in such types of cases. It is very early in my practice. When we don't have a confidence in early practice, such results always helps us to boost our confidence. Because there were many queries in mind, we have not seen such types of cases getting cured with homeopathy, and that's why always the confidence is less when we handle case of stammering speech. A child was brought to me, and he was just 5 years child, and I asked, "What's your name?" And the way he presented was very typical. I asked, "What's your name?" And he started, "My name is," and then he told his name later. The whole face got distorted because of it. It got into the spasm when he was uttering a first word of the sentence. There was a complete spasm of the facial muscles, and he was not able to talk. They have investigated him a lot. Everything was done, and nothing found. And they have done speech therapy, but it never works because it is right from internal cause. And the child was very frightful. He used to fear the ghost, he used to fear the strangers, and all those things, all that matters were there. But the typical presentation was very important. Stammering, when I opened the rubric in the repertory, there was a very typical sentence. That is a single remedy rubric. Very specific, very marked with the Stramonium. That I have used in that case. Rest of the things were there. That fear of dark was there, the stammering, fear of ghost was there, then the fear of strangers was there. Many more things which denotes the Stramonium. But basically, this presentation was characteristic. I will share what is that rubric is there. Just this is the rubric. Stammering speech exerts himself a long time before he can utter a word with distortion of face. Stramonium single remedy for 4 marks, it has been mentioned over there. This condition is also labeled as an rhizus sardonicus, where patient goes into the spasm, the facial distortion happens, and facial muscles goes into such a spasm, it looks very odd, and that is rhizus sardonicus. Even during convulsions, they get typical future like that. So Stramonium, I was knowing, but I was in doubt whether it will work or not. That was the question in my mind. And at that time, I never had a LM potency. I have never had a LM in early my practice. So I decided what to do. First, I decided to start with centesimal, but which potency? I was knowing that Stramonium is acute in action, but how much to repeat? Because few things were not practically learned. Regarding Stramonium, I have seen a case of religious mania which was treated with the help of Stramonium myself, and I was confident about it. But these type of physical features, whether it will reflect a change or not, that was thought in my mind, and I was in doubt. But still, I have started with this patient, the Stramonium 200, a moderate potency, for 2-3 days continuously, and kept the patient on placebo with a doubt in my mind. After 10 days, when the patient was there in front of me, I asked the same question. I want to see what's the difference. This time, he has taken a long time to utter first word, but the distortion of face was not there, which was there. He exerted a lot, my name, and but he never had a distortion of face. It was a good sign for me. So I was confirmed that Stramonium is working. I waited for another 10 days, but there was no further improvement. So I have decided to go for high. Once I have given 1 M, and after that, the follow-up was wonderful. Then this stammering has decreased nearly about 80 to 90%. His parents told me that even the problem was there in his classroom whenever someone asking question. Now his madam replied that he is used to answer very properly. Very occasionally he gets a stammering over there. And this is a big difference which we are observing after your treatment. So stammering speech, this is one of the important remedy where you get the patient exerts a lot before uttering first word. With many times in children, there is a rhizus sardonicus or facial distortion which happens to be there. So this remedy is a very important remedy in such types of cases. Let us go ahead with the remaining part of the Allen's keynotes. We have finished up to the head feels as if scattered about the future, which is very close to the bapticia that we have discussed in last lecture. Let us go ahead. Eyes are wide open, prominent, brilliant, pupils widely dilated, insensible, contortion of eyes. Contortions means change in shape of the eyes. Generally, it happens like a keratoconus like conditions where the eye shape is distorted, changed, and because of which the vision is obscured. This is very common with the Stramonium. It has used as a word contortion of the eyes and eyelids. Even eyelids, the change of position, and that's why many times it entropion is there. Sometimes that touches the sclera or touches the cornea and irritation of the eyes. So this contortion of the eyes and eyelids is very important feature which is mentioned by Allen. Pupils dilate when the child is reprimanded. Reprimand means someone scolds, takid dene, someone uses a bad words, and whenever child gets such a type of reprimanded or some reproaches from others, the pupils get dilated. The face is hot and red with the cold hands and feet. This is the thing which I have explained previously also, that you must make a habit of touching the patient's head, the palms, the hands, and lower extremities with the back of your hand. This is very important. I used to do that with people because we have to understand these things are mentioned in our Materia Medica and repertory, but we never look towards those things. What he says, face is hot and red with cold hands and feet. So these are the things which we generally miss, and that's why the clinical habits which you have to develop to check the temperature with the back of the hand. Circumscribes redness of the cheeks. So typical specific part becomes red, blood rushes to the face. So there is congestion of the face like belladonna. It is close to it because Solanaceae, family is Solanaceae. Rhizus sardonicus, that is what I have mentioned, that it is a distorted face. It's called as Rhizus sardonicus, and this is very common during convulsions, during spasms, during facial neuralgia, such during stammering, such a thing happens. Stammering, yes, this is what has exert himself a long time before he can utter a word, makes great effort to speak, distort the face. So this is what we have to understand. The Bovista is there, Ignatia is there, Spigelia is there, where the distortion happens, but not for the first word. The difference is there. Here it is right from the first word, it happens over there. Vomiting as soon as he raises the head from the pillow, from bright light. So, two things aggravate the vomiting. First, whenever he rises up, there is a vertigo as well as vomiting. And second thing, bright light, looking towards bright light produces the vomiting or nausea. Convulsions with consciousness, very, very, very important thing. Convulsions without consciousness or convulsions with consciousness. If it is with consciousness, Nux is another remedy. But if it is without consciousness, the belladonna, the cicuta, the hyoscyamus, the opium, these are the remedies. See, belladonna and hyoscyamus from the same family has opposite modality, opposite associated features. So convulsions without consciousness, belladonna and hyoscyamus is there. But with stramonium, it is convulsions with consciousness. Convulsions renewed by sight of bright light. That's why they look towards bright light. They get headache, they get vomiting, they get convulsion. Convulsions renewed by sight of bright light of mirror or water. So light reflected from the water, right? Light reflected from the mirror affect them a lot, and they get a convulsion. Belladonna, lysine, these are very important remedy. Here the belladonna and lysine comes closer because one more feature which is there with this remedy common is hydrophobia. I think that will come later. Twitching of single muscles and group of muscles, that is generally in the convulsions. This is very important feature. Twitching of the single muscles or group of muscles, especially of the upper part of the body. So convulsion, twitching of the upper part of the body, chorea. Chorea is involuntary movement of the certain single muscles or certain parts. It's chorea. And this remedy is again a very important remedy having action on brain and nervous system. So here features you can get very typical irritation of the nervous system. Hydrophobia, that's what I'm talking about. Hydrophobia with fear of water with excessive aversion to liquids, belladonna, lysine, two important remedies. Spasmodic constriction of the throat. That is constriction, that is not construction, that is constriction of the throat. So, this is a very, very important remedy for hydrophobia. I had one chance online to treat one case of hydrophobia, but patient was not survived, patient was on the verge of death, and the hydrophobinone was given without any result for that patient because patient was already on the death. Within a span of 1 hour, patient died. He was in a grave state. These are typical cases we never get generally in our practice, but if one do a work in the infectious hospital, there is chance to utilize homeopathic remedies and see the efficacy of it. No pain with most complaints. Painlessness is characteristic, like opium. This is again a very important clues to the opium regarding painlessness. Painlessness is a feature generally happens to be there because of benumb state in opium. It is completely benumb state. There is no pain. Specifically, whenever the patient goes into the comatose state and there is no reaction. But remedy, opium is from Papaver family and symptoms are rather different. Only thing is that painlessness you can get over there. Sleepy but cannot sleep. This is again opium. Opium is there, belladonna is there, chamomilla is there. They are they are absolutely feeling sleepy, but they cannot get the complete sleep. This is what Alan has mentioned regarding the stramonium. Let us go with the relationship, what he mentions. Stramonium often follows the belladonna, cuprum, iosamus, lysine. So these are remedies which comes closer. Only here the cuprum is depicting, rest of the remedies which are not so much depicting but having acute pace. In metrorrhagia from retained placenta with characteristic delirium, CKL often acts promptly when stramonium had failed. So patient is in delirious state like stramonium. There is a metrorrhagia and retained placenta, and stramonium is failed. It never worked. Patient looks like a stramonium at mental level, but the bleeding is not getting stopped. Think of CKL. CKL removes that very easily, and I have experienced it many times. Use of CKL in my practice, in my hospital. With fever, if similar type presentation is there, patient is in delirious state with fever, with septic tendency, then one must think of pyrogen. But pyrogen, one must think whenever there is a relative tachycardia. Means temperature is 100 and pulse is 140. So it is not proportional. So pulse is not proportional to the temperature and it is very high pyrogen, where you get a clean tongue with pyrogen. After overaction from repeated doses of belladonna in whooping cough. So you have given belladonna in repeated doses, but it is not working. Then you must think about the stramonium for that spasmodic cough. Modality, general modality, aggravation. Aggravation in the dark. Aggravation in the dark when alone. Looking at bright and shining objects. Aggravation after the sleep. This is very close to the lachesis, apis, opium, spongia. Aggravation when attempting to swallow. There is constriction feeling inside the esophagus, and that's why whenever they attempts to swallow, there is an aggravation. Amelioration from again from bright light, but generally it is not direct reflection of the rays. It is they requires the light because they fears the dark. So it is they are in the need of light, but not a reflection of light. Amelioration from bright light, from company, from warmth. They requires company. They cannot remain alone. There is phobia. And with warmth, warmth at both level. Warmth is support. That is also important. And warmth is physical warmth also. The action is not mentioned in any book. Only Dr. P. Shankaran sir in his booklets have mentioned the action that this remedy has 12 to 24 days action. And that's what my understanding and that's what my experience is there regarding the action. It is acute as well as chronic in action, but generally subacute is more common in chronic disorders. So this is a wonderful remedy one must learn by heart. The clinical experiences, many more clinical experiences are there with stramonium and a very acutely working remedy in our practice. So one should not forget to use the stramonium according to the states of stramonium. So we have finished one more from the third year syllabus. So that's all for today. Tomorrow we'll turn towards the next remedy. I think we are on the verge of finishing third year syllabus regarding the materia medica. So thank you being there and we'll meet again tomorrow at the same time. Only question is that if the loudspeaker is going on over here because of Ganpati festival, then we have to stop taking the lectures. It depends. I don't know exactly. Okay. So that's all for today. Thank you and good night.
Thank you very much, sir.
Thank you, sir. Good night.